Digital dentistry will completely transform your dental workflows and make life easier for you and your patients. Using intraoral scanners will transform your practice and help you provide better treatment to your patients, have better communication with labs, and overall improve clinical outcomes. I'll take you through an overview of the dental workflows and clinical applications that I use and that you can implement when using intraoral scanners in your day-to-day practice. There is no doubt anymore that every dentist should have an intraoral scanner in their clinic. Buying an intraoral scanner is a no-brainer anymore. Digital impressions are the reality today. They are fast, accurate, and can improve any dentist's workflow while giving patients a much better experience. I have personally reviewed the Helios 600 scanner, and I found it to be a good option for those who are looking for a more affordable scanner, like those in emerging markets where existing scanner options may have been too expensive. When transitioning to digital dentistry, you open up a world of opportunity in your practice. Gone are the days of messy impressions, gagging patients, and cupboards full of stone models. A scanner is a critical tool in any practice these days. With an intraoral scanner, you can quickly take an impression of a patient for any indication of choice. Whether this is for a single crown or a bridge, these can be easily sent to a lab online without having to wait for couriers or the mailman or risking things getting damaged or lost. If you want to do all these things in-house, you can invest in third-party CAD software like Exocad and move the production in-house, such as designing and fabricating a crown. Of course, this will require you to also invest in a milling machine or a 3D printer and learn some CAD skills or hire a dental technician. There are also orthodontic applications of intraoral scanners. You can export scans and upload them easily to various third-party aligner companies for orthodontic treatment simulation, treatment planning, and fabrication of aligners. Alternatively, you can also move this production in-house by using in-house orthodontic software, such as 3Shape Orthodontic Planner. If you do implants, then a scanner is even more useful. Whether you just restore implants or also place them, a scanner provides you with many benefits. When combining a CBCT X-ray with an intraoral scanner, you can use CAD software to fabricate surgical guides and plan implant surgery to reduce human error and ensure successful surgical outcomes for your patients. If you're not interested in placing implants, but only restoring them, taking a scan for an implant restoration is infinitely easier than taking a closed or open tray impression. The process is easier for both you and your patients. In literally 5 minutes, you can have the entire process completed and the scan sent to your lab for restoration fabrication. Scanners can also be used to restore all-on-X restorations. If you want to do it conventionally, you have to use a verification jig, but otherwise you can avoid all these unnecessary steps by incorporating photogrammetry devices. Cosmetic dentistry and smile design are also a major reason why we use a scanner in my practice. Using the Helios 600, I can take a full arch scan easily and then use the scan to fabricate a smile design mock-up. This mock-up can then be 3D printed, transferred to the mouth using a PVS and temporary crown material, and this is one of my favorite ways to increase case acceptance. Finally, digital dentures. We are moving into an era of 3D printing in dentistry. The resins are getting better and better every year. Very soon we'll be using 3D printers to fabricate many restorative indications. In our practice, we use scanners in combination with wash impressions to design and fabricate 3D printed digital dentures. Alternatively, you can also mill these dentures from a range of acrylic materials. So as you can see, there is a huge range of indications for your intraoral scanner. Literally everything you can do with impression material, you can do with an intraoral scanner and more. The time is now to get rid of messy, nasty impressions from your practice for the majority of your clinical work. Digital impressions help improve communication with your lab and open a door to transition to in-house production. There is a learning curve, but it is well worth it. Intraoral scanners like the Helios 600 enable faster and more efficient use of chair time and offer a much better patient experience than traditional techniques. Thanks for watching.